Okay. You guys ready?
The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone, and welcome to the Maricopa County News Conference on this May 5th, 2020 from the Unified Command. My name is Fields Mosley. I'm the Communications Director for Maricopa County. I'm also the lead PIO for the Unified Command. We'd like to thank everybody that's joining us on the webinar today, primarily reporters who are joining us here. Also would like to thank those members of the public who are joining us via Facebook and also on YouTube. So today we're going to talk about a number of different things, but primarily programs that are in place in our community that are here to help people in need. And we recognize a lot of people at this time have probably never had to engage in these programs. So we're going to talk a little bit about that. This is something Maricopa County is heavily involved in. We also partner with many nonprofits to make these services happen within our community, and we certainly want the public to know about these things. So I have three leaders here with me today to talk about some of these programs. Marcy Flanagan, she is the director of our public health department. You've met her before if you've joined us for one of these webinars, or you've seen her online on one of our social media platforms. She's here to talk a little bit more about the WIC program, the Women, Infants, and Children program, and public health helps run at least 2 WIC clinics here in town and certainly directs people to that program as needed. Also joining us today, Angie Rogers. She is the CEO of the Arizona Food Bank Network. She's here to talk about the availability of food for those in need and what opportunities you might have if you want to volunteer in that space or to donate in that space. The Food Bank Network, it's very important to note, includes many different food banks across the state of Arizona. Also a member of our COAD, which for those of you who weren't a part of that press conference a few weeks ago, that stands for Community Organizations Active in Disaster. And this is a very important coalition of nonprofit organizations that are out in our communities doing good. And during a disaster or a crisis or a pandemic, what we're seeing right now, it is very important those groups come together and they're providing services for people in need in our communities. Also, Bruce Liggett, he has been here a couple of times, and he's the director of our Human Services Department. He's going to update you on a number of programs that are going on right now that are there to help people in need at this time. Also, those programs that have been put in place to help those people who are experiencing homelessness right now. So we'll get an update from Bruce. So before I have Marcy Flanagan come up here, I'd like to tell members of the media who have dialed in on the webinar today, you'll be called upon by our moderator. If you're new to this process, you need to unmute your microphone on your end. We cannot do that for you. And then you raise your hand. When we call upon you, we'll unmute your microphone on our end, and then you can ask your question. We can all hear your question over the speaker here in the room, and then I'll make sure you get the appropriate subject matter expert to answer that question. If you are having difficulty raising your hand through GoToWebinar, or you're having difficulty getting your mic to unmute or anything like that, sometimes there are some hiccups in the software. You might have to log out and log back in, or you can call in through the number and we'll try our best to get to your question. Many times you guys try to ask multiple questions at a time. It's often very difficult to keep track of all the questions or to answer them exactly how you wanted. So if you do your best to ask one question at a time, we'll get to that. We've always been able to come back around and answer second and third questions from all the reporters who are on the webinar. So with that, I will invite Marcy Flanagan to come up. She is, once again, the Director of Public Health.
Good afternoon. My name is Marcy Flanagan, M-A-R-C-Y. Flanagan, and I am the Director of Maricopa County Department of Public Health. At Public Health, we work every day to support our community's health, whether we are in an outbreak situation or not. One thing we know that helps people live healthier lives is starting out with good nutrition. This sets a foundation for proper physical development, brain development, and meeting physical and developmental milestones like walking and talking. One of the programs Public Health offers year-round is our WIC program, or Women, Infant, and Children's program. This program provides healthy foods to nursing mothers, pregnant women, infants, and children under the age of 5. At times like now, when so many people are suddenly facing financial challenges out of their control, WIC can be a critical layer of support for these families, especially ones who are worried about feeding their children. People who didn't qualify before may now qualify if they have been laid off or have had a reduction in their hours at work. Dads and grandparents can also apply if they have children in the home under the age of 5. Many people assume that they don't qualify. However, a family of 4 can earn up to $3,970 a month. That equals $47,638 a year before taxes and still qualify for the WIC program. The exact amount varies by family size, so please check our website at maricopa.gov/WIC for more details. Our WIC staff truly cares about the families that they serve, and they provide a lot more than just access to healthy foods. One of the WIC initiatives that our families love is access to breast pumps, which can be a critical factor in determining whether or not a mother can continue to breastfeed. We know that breastfeeding has many physical benefits, not only to the baby, but to the mother as well. WIC families can also get help with everything from recipes for healthy food to their kids and referrals for health resources in the community and other tools that can help get their kid on the path to a healthy plan and start. To keep our WIC families and staff safe, we are now doing all of our services virtually. You can make appointments, submit documents, and more online, and have an appointment by phone or Zoom to speak directly with our WIC staff. Anyone who has questions about WIC services or eligibility can go to maricopa.gov/WIC to find out more and get started. Thank you.
Thank you so much, Marcy. I now want to introduce you to Angie Rogers. She is the CEO of the Arizona Food Bank Network.
Good afternoon. My name is Angie Rogers, ANGIERODGERS, and I'm the president and CEO of the Arizona Food Bank Network. We know that for many years, many of our neighbors across the state have been utilizing food bank services, and we have been able to support about 450,000 families every month with our food banks across the state. However, in this current crisis, we are seeing nearly 1 million individuals come to food banks right now seeking for assistance through the Emergency Food Network. We stand ready and able to help those individuals who need the additional support. We recognize that circumstances are hard for everyone right now, and during this time of crisis, we have plenty of food, and we want everybody across the state and across the county to know that we have food available if you need it. We know about 40% of the individuals that are accessing our services right now are new. You've never been to a food bank. You may have concerns about how the process works. It's very simple. We are practicing social distancing. You will be able to drive up in your car and be able to receive a food box. You will need to show some identification that just says you live where you do, proof of residency. And then we will be able to give you a food box. We have plenty of food in our network right now, and so we want to assure you that we have the ability to serve you. If you're looking for a food bank in your community, we want you to use the website www.azfoodbanks.org. That will connect you by inputting your zip code to the food bank closest to you. Alternatively, if you have the ability to provide resources for a food bank in your community, you can also use that locator tool. We encourage you to call ahead. Make sure that they are open. We do know that some pantries and food banks are operating under alternative hours, so we want to make sure that you call ahead to assure them that they are open and able to serve you. Second, we want to make sure that you know about an additional resource available to you through a texting hotline. If you go and type 877-877 into your phone and type the word food, or in Spanish, comida, you will be able to be connected to a school or otherwise community-based organization in your area that can provide school meals for your children in a grab-and-go model. You again will be able to drive up, you will be able to receive meals, likely multiple meals for your children, and so that you can receive those for any child between the ages of 1 and 18. Again, 877-877. Finally, we want to make sure that for those of you who have been receiving SNAP benefits, you may see an additional allotment in your food stamp allocation for the month of April and May. This is good news. This is not an error. We want to make sure that you're able to spend those benefits in grocery stores across the state. And so you will have those for the months, again, of April and May. That's great. Additionally, if you have children in your household who are receiving free and reduced meals through your child's school, they will see an additional allotment on those food stamp benefit cards. Or if you don't receive SNAP currently and you need access to those benefits, we encourage you to go to healthyarizona.org and apply for benefits, or otherwise call your local DES office. There are a lot of services and supports right now available for getting you the meals and nutrition that you need, and we encourage you to reach out. Thank you.
Thank you so much, Angie, for being with us today. Always nice to have a new voice here and providing important services in our community. So with that, I'd like to invite Bruce Liggett to come up here. He's the director of our Human Services Department here at Maricopa County.
Good afternoon. Maricopa County provides a whole range of human services. The whole lifespan is covered in terms of the populations that we address, and our employees in the county have been impacted like employees throughout the state. Yet Human Services is open and we are doing business. We're providing the needed services family need and are preparing for what happens as the economy begins to reopen. So what I wanted to do this afternoon is give you just a brief glimpse at some of the services we provide and how they've been impacted. Our Head Start program for young children and their families. Schools are closed, Head Start classrooms are closed. Yet we're staying in contact with all the families, contacting them regularly, making sure that children are still learning and delivering food boxes when we can. Some of the employees of Head Start are helping with some of our other human services programs now. There's a lot of talk about the economic impact of the pandemic on employers and on employees, particularly some sectors such as hospitality. Stay-at-home order has affected the number of people coming into our workforce centers. We have 2 in the county, 1 in Gilbert and 1 in Glendale. Yet we're still seeing about 400 people a week, and these people are coming into offices to sign up for unemployment insurance. The Department of Economic Security is co-located with us, our offices, and also for help in finding jobs in this very difficult environment. Unemployment insurance is creating some traffic that we're seeing. Others are doing lab search, and through our workforce program now we are offering online virtual work with a career guidance specialist, and also we have virtual job fairs where employers are able to meet with people electronically and conduct an interview and be able to get a lead on a job. We operate crisis community services, so for years and years we've been providing utility assistance and rent assistance. We've done this historically. There's always been a greater demand than we had resources for. We're never able to meet the need. In fact, we stretch out over the year so some people can get every month. Now there's never been more demand, obviously. People are out of work, they need help with their utilities, and they need help with their rent. So we're operating some eviction prevention programs that are designed to help people stay in their homes so they can get back to work and be part of the economy. The number of applications we've got for all of our programs has gone through the roof. We're doing the best possible job we could do to respond to that demand. Like I mentioned earlier, shifting people from other sections of the department, but we'd appreciate your understanding. We absolutely will process all applications as quickly as we can. Finally, the work that we do with seniors under a contract with the Area Agency on Aging, we assess seniors' needs. We typically go into their homes and do assessments. We authorize services such as Meals on Wheels, personal care. Obviously now, the vulnerable population, seniors and adults with disabilities, we're not making home visits in 90% of the cases. We're doing reassurance calls with those families to make sure they're getting the services. And you've heard from both Marcy and Angie just how important nutrition is to all populations. So we're continuing our work with community partners and preparing for the immediate future when things begin to open up more. Also wanted to give you a very quick update on where we are with some of our homeless work activities. Last week, we brought up a 24/7 available medical triage line designed for homeless shelters and for hospitals. So we've got staff who receive those calls, can help people with screening procedures if people are symptomatic or are positive for the coronavirus. We have transportation, and we're able to get them to an alternate care facility for them. So that is in place for shelters and hospitals now. We've established a couple alternate care facilities. We have a facility in Mesa. It is a unique partnership with the city of Mesa, Tempe, and Chandler, where we put vulnerable people into hotel rooms. They're providing the staffing. The county is providing the cost of the facility and the security. So that's full now and operating in the East Valley. In addition, we have another leased facility, and we've got about 29 people in that for a capacity of 48. So again, these are vulnerable people, and the latter group, we're testing them before they go into the facility. To give an update on the voluntary tent plan, where people are relocating their tents to achieve what the Center for Disease Control has said should be the correct distance in terms of spacing, physical spacing of people. We have 2 small lots and a larger lot. The 2 small are filled with a total of about 90 between them. The larger lot can hold 100 to 120. We have today in that up to about 65. So we've got about 155 people that have relocated voluntarily their tents to these, be able to practice social distancing. We continue to work with our partners on this, and probably within the next few days, those lots will be at capacity. But we will achieved or exceeded our goal in terms of what we wanted to create in terms of an encampment environment. Thank you.
As you can tell, Bruce's team has been very busy. We appreciate his time today. It's valuable. They have a lot of different programs going on and doing a lot of good out there in the community. So we will now take questions and provide answers as best we can. I want to make it clear to everybody once again, you'll raise your hand virtually. If you've been with us before, you understand how to do that. In addition to answers that our subject matter experts will provide in English, Joanna Molina is here from the Department of Public Health, and she will provide answers in Spanish. I also have Robert Rowley, our Director of Emergency Management here. If you're reporting on the amount of personal protective equipment in the community or any of those emergency management related questions, he is also here in the room with us today and can provide some answers on those if you have those questions today. So with that, I'll ask the question. Are there any questions right now?
Hi, I'm not sure to answer this question is, but I'm wondering if Maricopa County's COVID data supports the reopening steps that the governor has announced.
So Maricopa County's data that we're collecting on the number of cases, the number of deaths, the hospitalizations, there's a myriad of data that's on our website every day, and if it supports what the governor has lined out. I think it's fair to say that the governor is using statewide data, and you would have to ask them about that data. He lined that out very clearly yesterday during his press conference and how he wants to phase in an approach of reopening the economy. And our data is slightly different here in Maricopa County. And yeah, we're evaluating that every day, but it's really the governor's call as to what reopens and when it reopens. And that is, that's not for the county to say. We're here to support that, support his decisions. He's the decision maker on what reopens and when it reopens. And Marcy, I don't know if you have anything to add about the data specifically.
I can talk about Maricopa County.
Okay. Marcy Flanagan, the Director of Public Health, she can talk a little bit about what we're seeing in our numbers here in Maricopa County.
So in Maricopa County, our data does look slightly different from the state, but as Fields mentioned, the governor is looking at the statewide data and making his decisions based on that statewide data, which aligns with the recommendations from the CDC and federal government. In Maricopa County, as Dr. Sonnenschein has mentioned before, and as we've talked about, we really did see a slight dip in our numbers and then a really plateau leveling off. So that is still consistent in Maricopa County, and we are still monitoring daily all of those numbers, but we really have seen a slight decline and a plateau happening.
La pregunta fue que si los datos de COVID-19 concuerdan con los datos del gobernador de reabrir parte de la economía. Y lo que se ha mencionado es que nuestro apoyo es para lo que el Estado está haciendo. El gobernador sabe cuándo se abren las tiendas o los sitios. Nuestro Información sobre datos es lo que vigilamos constantemente en el condado Maricopa y hemos visto que esos datos han bajado un poco y ahora se han estabilizado. Entonces estamos aquí solamente para apoyar los datos del condado Maricopa y también la decisión que tome el gobernador.
Thank you for the question. Do we have another question?
There are no other questions.
Sorry, Chad, you're a little bit low. There's no other questions at this time?
Looks like Rachel does have a follow-up.
Okay. Go ahead, Rachel.
Not a follow-up to that necessarily, but a different question.
Okay.
I'm looking for an update on contact tracing and if the county has provided additional resources there to continue doing a high level of contact tracing.
Certainly, I believe it's been a week or so. We talked about contact tracing in depth. I know Marcy Flanagan will address that.
Thank you for your question. I just want to start out by saying that Maricopa County has done contact tracing and case investigation since the beginning of this pandemic and has continued that. We did go to case-mediated contact tracing. However, we are starting to do more intensive contact tracing. We have a plan that is being finalized, but we have opened several positions that are available on the maricopa.gov website for contact tracers to increase the amount of staff that we have working directly on contact tracing.
La pregunta fue que si, ¿cuáles son los datos para darle seguimiento a los casos que han tenido contacto con COVID-19? En el pasado siempre se ha dado seguimiento a los casos de una situación donde hay contacto de enfermedades. Se le da seguimiento a cada caso que la persona estuvo en contacto. En este caso también, como ha subido el número, ahora los casos han reportado sus mismos contactos cercanos que pudieron haber estado expuestos. Ahora hemos incrementado el número de personas y también hay posiciones abiertas en maricopa.gov para que la gente pueda solicitar exactamente esos puestos donde podemos darle seguimiento más a los casos que han estado expuestos con COVID-19.
All right, another good question. Thank you for that. Chad, do we have anybody else?
Yes, Ann Lyman has a question. Ann, your microphone is live.
Could we get an update on the PPE situation with long-term care facilities and also the testing at the facilities there?
Okay, an update on the personal protective equipment in long-term care facilities and what our role is in providing that equipment. Robert Rowley, Director of Emergency Management, will have to answer that.
Good afternoon. The situation for personal protective equipment for long-term care facilities remains pretty much the same as it has been. We have been receiving some of our orders for new PPE. We've received some orders from state resources and through the federal supply chain, as well as resources through some of our local manufacturers, including AmSafe, which donated approximately 2,500 surgical gowns. So with all of those resources, we've been able to maintain a supply to the long-term care facilities for whatever they're asking for. It still remains tight. We don't have as much as we'd like to have that would make us feel comfortable, but we're still able to provide those resources at this point. Thank you.
La pregunta fue acerca del equipo de protección personal, que si cuánto existe y qué se está haciendo en los centros de cuidado médico de largo plazo. La respuesta es que al momento existe lo suficiente para poder suplir esas necesidades, pero falta aún más. Entonces hemos recibido las dotaciones que nos han llegado, las órdenes que se han pedido, sin embargo aún falta todavía. Y lo que quisiéramos es que siguieran llegando todavía, así que estamos en espera de poder suplir más.
Thank you, Ann, for the question. Are there any other questions?
And would like a follow-up. And your microphone is live again.
Could we get an update on the testing for the long-term care facilities? Last week it was mentioned that there would be some, you were working on trying to get some partners to do more tests in the long-term care facilities.
Okay, so if we've gotten to a certain level of testing for long-term care facilities, Marcy will handle that question as well.
Hi, thank you for that question. So we have started discussions, and we do have long-term care facility testing that will begin hopefully early next week. You also heard yesterday Dr. Chris talk about ADHS is starting a pilot program to do testing in long-term care facilities. So we will coordinate with ADHS and hope to expand that very broadly in the Valley in the coming weeks.
Una pregunta fue acerca de las actualizaciones de pruebas en los centros de cuidado de largo plazo, en donde estamos. Y la respuesta es que empezando la semana que entra, el Departamento de Salud Pública del Condado Maricopa empezará a hacer esos tipos de pruebas en estos centros de cuidado médico de largo plazo. También escuchamos ayer en la conferencia de prensa del gobernador que el Departamento de Salud del Estado empezará también a hacer y dar seguimiento a estas pruebas en los centros de cuidado médico de largo plazo.
Thank you, Ann, for the question. Chad, do we have anybody else on the line?
Do not.
All right. Well, I'd like to thank everybody for participating in the webinar today, and those of you who are joining us either on Facebook or YouTube, thanks so much for being with us. We'll send out an advisory very soon whenever we have more updates to provide to the general public and also to our friends in the media to let them distribute that information as best we can and keep everybody informed. So thanks once again for being with us today.
Claire.